Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Colleen Naglee. She's an anesthesiologist, and today's Kevin MD article is We Should Tip Healthcare Workers Too. Colleen, welcome to the show.
Thank you so much. I'm so glad to be here today.
All right, so
Appreciate the opportunity.
just briefly share your story and then talk about the Kevin MD article for those who didn't get a chance to read it.
Great. So I'm an anesthesiologist and neurointensivist working at a small academic program, and I recently graduated law school as well. So I've really been paying a lot of attention, thinking about healthcare systems and how to improve them, which is, a huge challenge. Yeah. Taking a cue from some of the service industries, if we look around at how service industries are working these days, a lot of dissatisfaction, from everything from Starbucks to Walmart to healthcare. There's nothing unique to any of those service industries. But some service industries have taken to tipping as an option for instead of paying people better or improving their situations and benefits. And I thought it'd be funny to see what it would look like if we applied that to healthcare. Of course, it sounds silly, but the idea that, hey, we're a service industry too. Why don't we apply the same systems that other non-healthcare systems are using?
So in your article, you talk about some of the risks that healthcare workers face, even though we are part of that service industry. So talk about some of the risks that we face.
Absolutely. So it's sad, but violence against healthcare workers has really been rising in the last couple of years, and it's one of the most violent industries to work in, which isn't something that people usually associate with healthcare. And the laws have been slow to respond to that, where we honestly allow a lot of violence in healthcare because we recognize our patients are in distress and have a lot of medical issues and psychological issues at the same time. So, thinking about how prevalent it is, most people who work in healthcare have seen it, and it's unfortunate. And it would be better if we really focus more attention on how to protect healthcare workers in these situations so they're not exposed to the situations at work that honestly no one wants to be involved in.
Yeah. How common is it? We certainly hear occasional cases about episodes of violence in medical centers, but it's been a while since I've been in an academic medical center or a large medical institution. So you're more in tune with it than I am. How prevalent is violence against healthcare workers? And we're not just talking about physicians, but nurses as well, right?
Absolutely. So nurses have some of the highest rates of violence, and that's because they spend a lot more time with patients than most other healthcare providers. If you look at, there was one study of ER nurses that was done a couple of years ago, and 100% of the nurses reported violence recently by a patient against them.
Wow.
Not saying they were necessarily harmed, but there was at least an attempt to commit violence toward them. And nurses' aides have the same issue where they're seeing a ton of violence. If you look at physicians, it depends often on specialty. So if you're a physician that works in a psych facility, your risks are very different than someone who works in an outpatient dermatology clinic, right? We see differences. But compared to other industries, it's 5 times more common to be a victim of violence in healthcare than if you're a construction worker or, a police officer. And that's a really notable statistic.
So more recently, more and more guests on my podcast have been speaking out and bringing awareness to healthcare workplace violence. Why has it been traditionally, it's been so underreported and kind of swept under the rug?
There's a lot of reasons. And there's been actually some studies that looked at why people don't report it. The first is that folks don't feel that if they report that it'll be taken seriously or anything will be done. And that's in part because the legal nature is often that we don't charge these patients with assault, right? The second major issue that goes on is that we recognize that our patients are in a rough situation, right? Many of them have been given medications which affect their brain. Many of them have underlying psychiatric issues and they're in pain, and they have other psychosocial challenges to their situations in the hospital. So there's an empathy that patients are lashing out, not in a healthy way, but in a way that is somewhat understandable given their clinical conditions. And then you have folks who just say, look, this happens every day. What's the point? I'm always going to have patients who are going to grab my arm or whatever, and I'm just going to move on because it's not worth going through that process. So it's multifactorial for why there's underreporting, but it's certainly it's a sad reality.
And it's not just violence against healthcare workers. There are just so many obstacles that really prevents healthcare workers from doing the best they possibly could for patients. You mentioned a few in your article, things that could affect staff morale, takeover of private equity on various services in a hospital. So talk more about some of those issues as well.
Yeah. So, I've been in medicine for, close to 20 years. And when I think about team-based dynamics, we all perform better in teams. So
Yeah.
when you have a consistent team where everyone has a role and everyone understands their relationship to each other, and everyone has institutional knowledge about how to do whatever job it is, and this applies to everything, the operating room, outpatient clinics, ambulatory surgical centers, it's all a team-based approach. And then you take that team and you disrupt it. You
Yeah.
disrupt it by having burnout providers and burnout nurses. You disrupt it by having high turnover of staff because they're unhappy with benefits, et cetera. You lose that team, you lose that morale, and then you ultimately lose institutional knowledge too. And it's hard to underestimate how important those are to successful care of a patient because no one can do their job in a vacuum. We all rely on each other. When we can't rely on someone because we've met them, 2 hours ago, it's
Mm.
much more difficult to do the right thing.
And you also mentioned the impact of declining reimbursements from private insurers and Medicare. That often doesn't generate a lot of sympathy towards physicians because historically there's a perception that physicians are among the best paid professions. But talk about how those declines in reimbursements, how does that affect physician morale?
So, we push a lot of, especially primary care physicians, to see patients in shorter and shorter periods of time for less money. And, that affects the physician patient relationship, right? So, if my primary care used to spend an hour with me and really understand my issues and know that I'm having difficulties at home and that's really why I'm not taking my antihypertensives,
Yeah.
it's hard to get that in 15 minutes. And so we've disrupted a lot of those relationships by tying all the work we do to reimbursement instead of the quality of care, instead of patients, who are really happy with their care. We tie so much of it to just procedural expectations and then to quick turnover of patient care. And that it really diminishes our relationship with each other and with our patients.
So what's kept you going though? You have a unique perspective, obviously from that law background, and you've been in medicine for 20 years. So the path going forward, where do you see this going? You have certainly in other service industries, like you said, symbolic gestures like tipping, but in healthcare, that seems a little bit, obviously superficial, and we need more systemic change. So where do you see eventually this leading to?
Well, I'd hope that there starts to be more of a recognition at a national level that we need to look again at how we provide healthcare. So, how do we provide for all Americans? How do we deal with insurance companies, big pharma? I think it's time for a radical, revolutionary approach to how we approach healthcare. And I recognize that this is tried in, every couple of years that people try to revise how healthcare is done, but I think we're a little bit overdue. We provide in the U.S. some of the worst care for the amount of money we spend, and I feel like it's time. And I don't know where the tipping point lies, where finally we say as a country we're ready to revise how we consider healthcare. But I would love to reach that point, and I'd love to be part of that solution. I just really hope to inspire people to start thinking that, there's alternatives and there's many different ways that we can deliver healthcare. Look at all over the world, and there's probably better delivery models than what we're currently doing.
So tell us a story about things that you've seen in your individual medical institution or you've heard from your colleagues that's really moved the needle in terms of healthcare workers being better appreciated or something that really helped with the morale of healthcare workers. What have you seen work?
What have I seen work? That's a great thing. I think that recognition from the top really matters. When your boss says you do a good job, you're happy, right? When
Yeah.
your friend says you did a good job, you're like, oh, that's cool. And it doesn't have to come with money, but I think acknowledging the work that we all do and the rewarding people who do a good job is important. And I have seen, examples where during COVID, for example, where everyone's really burned out and unhappy, that just an email from my boss, saying I did a good job would have meant the world to me. Instead, it's an email with another protocol to
Yeah.
follow. And recognition and acknowledgement of the work that we all put in plays a big role in our satisfaction. I read once that people leave their jobs for two reasons. They leave them for money and they leave them because they don't like their boss. And I've always thought that it's if we just put more energy into how we treat each other, that we could really get a better solution and that we could help each other feel more satisfied in the work that we do every day.
That seems like a pretty common sense approach. Do you not see that happen enough where our superiors or our colleagues or our bosses or administration just simply don't recognize the work that healthcare workers do enough?
Yeah, I think that's totally true. I mean, I think if you just think about most of our daily lives, how often are you getting rewarded by the health system for the quality of the work that you do? I'm not
Mm.
talking like how many UTIs, but the overall care that you provide. It's not something that is hugely focused on, and instead we focus on throughput. We focus on things that are easy to measure, like did you get into the operating room on time? Did your patients fill out the Press Ganey survey after their clinic visit? Rather than thinking more holistically about the care that we provide, which is a radically different approach to medicine than the way that we've looked at it for many years.
And I mentioned this earlier in terms of the impact of private equity, right? That further increases the focus on objective metrics like revenue and really drives more of that wedge between doctor and patient.
Yeah, absolutely. I think that anytime that you switch the focus from care to money, you're going to have a problem and you're not going to be as happy with the way that things turn out. That it's great when health systems make money. I'm not against making money, totally for it. I like to have a salary too, but it's great when we align that money with things that improve the quality of our care. And I'm not sure that changing to private equity and some of the ways that we're handling insurance and pharmaceutical care these days are really doing better care. They're just more financially driven.
What kind of advice do you have for your fellow clinicians and healthcare workers who may be burnt out and not feeling appreciated? So, do you have any advice for them in terms of how they can continue moving forward?
Well, that's tough. I know for myself, I've looked around a lot of different health systems, and I do think that some health systems have a much better systems and much better support of each other. So I will say that finding the place that's the right match for you is huge because if you're happy where you live and you're happy with your coworkers, it's extremely rewarding compared to being dissatisfied with that. So culture makes a difference and would encourage people to be very thoughtful about the culture. I also work with a lot of trainees, and I tell trainees this that you are the ones who are going to decide the culture of the future. And we should all make a really concerted effort to think about what culture we want. So, how do I make a phone call to a consultant? How do I talk to a patient? How do I talk to the nurse who did something I'm not super happy with? All of those things are about culture. And I tell trainees that you have to make a decision. Are you going to yell at these people when you could be kind? Are you going to try to create protocols and systems that are good for your patients? And if you do, you might be really happy with those results. So constantly be thinking about the effect that you have on those around you and the way that you can move the needle as in the future.
I talked about this topic with one of my former guests, and they talked about the politicization, right, of health information and the current political climate, where expertise, specifically medical expertise, sometimes can be devalued. Are you seeing some of that in your healthcare system and the colleagues that you talk to? And do you think that's also leading to some of the morale issues that you're seeing in the healthcare workforce?
Yeah, I think there's a great distrust amongst many Americans of healthcare systems and of physicians. I'd like to write another article on that because I have lots of thoughts on that as well.
Yeah.
But I will say that it does a disservice to all of us, and I think that we are also responsible for that, right? So by not listening to patients and not taking some of their concerns and their Dr. Google searches seriously, they're going to distrust us as well. So I think the street goes both ways, but the general distrust of healthcare workers is really tough. I mean, when you have patients, you say, this is what we should
Yeah.
do. And they say, I don't believe you. I mean, I have patients, I say, I'm really sorry your loved one is brain dead. And they're like, no, they're not.
Mhm.
It's really difficult to get around that. So I would love for us to be thinking also for the future about how we start to engender more trust with Americans and providing care.
And how can we do that going forward? Is it simply listening to patients more? What are some ways that we could regain some of that trust?
Yeah, I think listening, and I think this goes to like the restructuring of healthcare, right? So
Yeah.
if you valued, our relationships with our patients more than our procedural skills, then maybe we would focus on that more in training and after training and how reimbursement works. If we gave primary care physicians more time with their patients, they probably would trust them more.
Yeah.
I actually found a great study once where they were looking at end of life care, which is something I spent a lot of time doing. And if you just let the patients talk more in end of life conversations, they actually trusted you more and thought that you were a better
Hmm.
doctor. So listening is really an underrated skill, and hearing what people have to say and meeting them where they are. Instead, we meet them where we are, and that's not always as effective.
We're talking to Colleen Naglee. She's an anesthesiologist. Today's Kevin MD article is We Should Tip Healthcare Workers Too. Colleen, let's end with some take home messages they want to leave with the Kevin MD audience.
All right, this is the hardest part. So think about take home messages that it's time to radically reassess how we look at healthcare and our care delivery systems. Think about whether they're effective for both us and for our patients and whether they are delivering the results that we want. And I think if you are honest with yourself, you would say the answer is no. And then, we all play a role in advocacy and looking for how we can even improve our local environments to make better healthcare for our patients.
Colleen, thank you so much for sharing your perspective and insight, and thanks again for coming on the show.
Thank you. I really appreciate it.